All right, here we go, everybody. Good morning. Welcome to the EQIP Subgroup. Olivia, are we cool to start?
Yeah, let's get started. Thanks, Gene.
All right, cool. All right. Hi, I'm Gene Ransom. I'm chair of the EQIP committee, and welcome to our regular EQIP update. We've got a pretty packed meeting this morning, but hopefully we won't use the full time we reserved on your calendar. Really good news and updates from the HSCRC staff and from Kim from CRISP on enrollment, some updates on ahead, and other things. I wanted to start with two big issues. One is the new episode development. So for those of you who've been around for a while, typically in the fourth quarter of the year, we start talking about new episode development. And I just want to remind everybody that obviously most of the episode development we do through whatever bundler we're using. The first few years it was Prometheus. So we'd look at what was available in Prometheus and then work with clinicians to develop the things that weren't quite done or weren't quite ready. So obviously we've switched to PACES now for a couple years, and we're using the PACES episode. So we're going to be touching base with PACES to see what's not complete or not ready. And we're going to see and try to match up what's not available to clinicians. But the other thing we'd like you guys to do is to let us know if there's any bundles that you would like to work on developing directly. If you recall, we can develop bundles outside of PACES. Now, having said that, as you also recall, it takes a lot more work and a lot more time, and we really need clinical help to do it. So if anybody is interested in trying to develop their own bundles, they can reach out directly to me or Olivia, and Kim from CRISP has created a form that can be filled out, so you can use the form as well. After the meeting, Olivia or Crystal will send out the link. So if you're interested in doing a development or an area where you think we need to add new bundles for performance year 6, that's the opportunity. One of the other things MedChi is going to do is we're going to reach out to the specialty societies between now and the end of the year and make sure they're aware of what bundles are currently available in their specialty and ask if there are any others that make sense. And we're also planning on, once we get from PACES, the bundles that are not fully developed that could be added. What's going on? Can you hear me, Olivia? I think somebody's saying they're having trouble hearing.
I can hear you.
I can
Okay.
hear you as well, Gene. So
All right, good. So
I can hear.
good. All right. Anyway, so the important thing to know here is that we are going to really try to look and see if there's opportunities to add new episode development. If this is something that interests you, please reach out right away. I wanted to make a couple other quick announcements before I turn it over to Kim. First of all, today the Maryland Healthcare Commission is having their fall forum on advanced primary care. So really interesting opportunity for those of you who are doing population health. Olivia or I will put the information on that forum in the chat. Also, the Maryland Healthcare Commission is doing research for a report on advanced payment models and value-based care by private payers. So I would urge you to fill that out as well, and Olivia will send that out to everybody in the group. So again, if you're interested in developing a new episode through EQIP, this is the time to reach out to us. If it's a new episode, you need to reach out yesterday because it takes a lot of time and we're going to have to do a lot of work. If you're interested in developing one of the non-selected PACES episode, that's a little bit easier for us, but it still takes some time and some clinical work. So having said that, I'm going to go ahead and turn it over to Kim from CRISP, and she is going to drive us through the rest of the meeting. Kim, it's all yours.
thank you, Gene. Good morning, everybody. Is William on, Olivia? Do you know? William, are you on?
I don't see him just yet.
Okay. We'll come back then to the ahead updates because William was supposed to speak to that today. And so when he jumps on, Olivia, just let me know and we can come back to that.
I mean, if you want, I can just do the best I can and do a quick ahead update for everybody, for those who don't know. So just so everybody knows, obviously the state and the federal government have been negotiating amendments to ahead, and there is a term sheet that has been essentially agreed to by the staff levels, and we are waiting for amendment language from the federal government, which as of 5 o'clock yesterday, we did not have, the state of Maryland did not have. So I think as soon as that comes back, there obviously will be a negotiation between the principals, and then we'll go from there. The most important ahead update for everybody on this call is that originally, many of you probably heard that EQIP was going to be eliminated in the original discussions. That is not the case now. The term sheet changed that, and I don't think we've had a meeting since that happened. CMMI has realized that EQIP is a really good program and it's saving money. And I think you'll see when Kim goes through some of the data why they probably changed their mind, because the numbers are really good and they've decided to keep it in place. We are also having high-level discussions with CMMI about possibly including EQIP maybe in other states, and also how maybe we could align some of their work on bundle payment with some of the stuff we're doing. So very positive news from the federal government on the EQIP program, but we still have a lot of work to do to finish everything up, and there's still a lot of negotiation going on. So that really at a high level is the ahead update. And William obviously has probably forgotten more than I know, so when he pops on, he can add a little extra color. But that way, I think the biggest update is that it looks like EQIP is here to stay. So that's good news, at least as of today.
Gene, Michael Bond here. Are you able to share the term sheet so we can see what they're talking about?
The term sheet's not a public document, I don't believe, but I can ask and see if that's a William question. And maybe Dr. Bond, you and I can follow up offline.
Thank you.
Okay.
All right. Thank you, Jane, for that. Appreciate it. So moving on to performance year 3 incentive payments. The incentive payment methodology follows a few clear steps. We compare an entity's cost against the target price. To qualify costs must be at least 3% lower than the target, which will ensure the savings are statistically meaningful. And new entities that are placed into, they're then placed into 3 savings tiers based on efficiency compared to statewide performance. And the tiers are what determines how much of the savings that are shared. So for the lowest efficiency group, at 50%, is what is the shared savings. For the middle tier, it's 65%. And then for the most efficient group, it's up to 80%. So once the tier is set, we apply the quality adjustment after that point. And then 5% of the savings is withheld and then is earned back depending on the performance of the 3 quality measures. So this ensures that payments are then tied to both cost and quality. Before finalizing, there is a payment cap that we have to take into consideration, and the incentive payments cannot exceed 25% of the prior year's Part B payments as required by CMS. Finally, once all the checks are completed, HSCRC directs the CRP entity to issue a single lump sum payment to the EQIP entity, and payments are typically made 9 to 12 months after the performance year ends. And then it's up to the EQIP entity to decide how those funds are distributed to the care partner. Under the agreement with CMS, incentive payments can only go to care partners who have a signed care partner arrangement with the CRP, okay, with the CRP, meaning you cannot share this with any other care partners that are actually not fully participating in the EQIP program. So for EQIP and HSCRC has created a standard care partner arrangement that every care partner must sign in order to participate. And this makes sure that the payments are going to the right place and that we're fully compliant with CMS's requirements. All right. When the entities enrolled in EQIP during the PY3 application phase, the payment remission receipt, which is the screenshot that you see right here, is entered into the portal, that's what it was used to generate the actual care partner arrangements. As we prepare for the 2024 payments, UMMC has already collected most of the W-9s from the entities that entered this information into the systems. For those that we don't have yet, we will be reaching out to the entities via their admin proxies to obtain this information. It is critical that the W-9s match the care partner arrangements exactly. This ensures that the CRP will be sending the payments to the right place. And again, we remain fully compliant. Okay, if the organization name or address on the care partner arrangement and on what's on the W-9 do not match, we can't issue a payment to you. To fix this, and this is part of the process that we're going through right now, to fix this, we have a couple of options. We either need to have the entity submit a new W-9 that matches the care partner arrangement, or if the W-9 needs to be replaced, or the W-9, should the W-9 be the replacement for the payment remission information, then all the care partners will have to re-sign a new CPA, that's a lot of effort, but that is an option if that's how we have to move forward. Again, doing these steps makes sure that we remain compliant with CMS requirements. Don't panic. If there's an issue, we will be reaching out to you to let you know. Otherwise, if you don't hear from us, you don't have to worry about it, okay? All right, moving on to the next slide. So the EQIP entities that have earned incentive payments but have a CPA and a W-9 mismatch will, again, like I said, we'll be reaching out to you. So please be on the lookout for those emails. If amendments are needed, they'll be due early to mid October is when we'll probably be asking them to be redone by. And then payments will go out to the entities in Q4 2025, so Q4 of this year. They'll be sent by FedEx, and then for entities with PO box, payments will be issued as paper checks instead. CRSP will work directly with each of the entities to make sure that the amendments are completed and payments are processed correctly on a timely manner. Okay, so from here, I'm going to hand this off to Crystal, and she's going to walk through some of the enrollment updates and the next steps. Go ahead, Crystal.
Awesome. Thank you, Kim. Good morning, everyone. We're going to just quickly review enrollment and how it went and some stats that we got from that. And this is specifically pertaining to the enrollment that is closed for PY5. So looking at the PY5 enrollment summary, we had 217 EQIP entities that enrolled in EQIP in total this year, with over 7,000 care partners, which is like outstanding. There's so many people participating in the program all across the state of Maryland, so that's amazing. We have about 44 specialties represented across all the entities. The smallest entity is one care partner, and our largest entity comprises of 621 care partners. And about 133 EQIP entities are participating in more than 2 episodes. And as you can see, as you know, this year we did expand EQIP to go over a lot of different clinical episode categories. And here you can kind of review the number of EQIP entities that participate in each specialty category, as well as the number of care partners that are within each. Next slide. You can go to the next slide. Okay, perfect. And this is just another slide that kind of reviews that as well. And to touch on, just as we know, we had a migration within the CRSP portal to have reports and EQIP live all in the CRSP portal. So I just want to kind of review how to access EQIP for those who are new and those who are returning entities, just so that there are no issues with you all if you need to review your data or do anything with your enrollment. So first, you'll go to portal.crisphealth.org, and that is the domain for the CRSP HIE portal. Once you arrive in there, you'll be able to see in your dashboard a reports tile. And as you can see on the bottom, it looks like that. If you do not have access to the reports tile, please feel free to reach out to the EQIP inbox and we can assist you. And then if someone could just drop that email in the chat just for everyone to have. Once you click on the reports tile, you can go to the next slide, Kim. It'll take you to into the actual reports portal, and you'll see the Medicare population tab. If you do not see this tile, again, just feel free to reach out to the EQIP inbox so we can get you all set up with the access. But you'll go to the Medicare population tab, and once you click on that, it'll lead you to the EQIP enrollment portal tab. And once you are inside the EQIP enrollment portal, this will typically be your view. You'll be able to see the program period, which for any and all users now, it will be PY5. And if you've participated previously, you'd be able to use this drop down to go to different years such as PY4, PY3, etc. In that right-hand corner where it says EQIP entity, you'll be able to view your EQIP entity ID as well as your name. And then in the bottom, you'll see enrollment. That start enrollment process has been grayed out since enrollment has closed. But if you do need to make any changes, for example, an email address for a care partner or a phone number or a specialty, etc., you can go to the revise enrollment button and make those changes. And then also, if you are looking to add any additional administrative proxies, and these are the people who will be handling your data, being able to view it and have access to the PHI in the portal, you are able to also add additional administrative proxies. The system does have a cap at 9 admin proxies per entity, so you wouldn't be able to go over that, but you can add up to 9. And then in that program management section, there is the care partner dashboard, and this will be the full list of all the care partners who were submitted to participate within your entity. And then we have that program data section, which you can't see right now. However, once the performance year starts, you'll be able to review your entity's data as you all participate throughout the performance year. And any returning entities currently likely will have performance data already in there, and you are free to review it. And in that right-hand corner, you will see that enrollment is now closed, and it'll open up again next year in July. You can go to the next slide. Perfect. So we just want to kind of briefly review the EQIP timeline and next steps now that we are out of the enrollment process. So as you can see, the September through December section is bolded and in blue. So this is currently the part of the timeline that we are in. Right now, we are completing CMS vetting, eligibility auditing, as well as contracting. And all of those things will kind of happen in succession. And on the next slide, I'm kind of going to review how that will be done and then the order. So right now, the EQIP team is in the process of de-duplicating the care partners across EQIP entities. Something that we run into during the EQIP program is that we have a doctor who may work part-time at one facility and full-time at another facility or vice versa. And sometimes entities can both submit the same NPI for 2 different EQIP entities. However, within EQIP, you can only have a care partner participate in one singular entity at a time. So right now, the EQIP team has sent out emails on September 17th to contact the lead care partners as well as the administrative proxies for all care partners who were duplicated across more than one entity. Now, in that email, it does stipulate that by Wednesday, September 24th, you do need to respond to specify which entity that NPI will belong to. Now, if you did not receive this email, then that is good. Your entity has no duplicate NPIs. But if you did receive this email, we do need you to reply at least by Wednesday, the 24th. And if you do not respond by that date, the care partner will automatically be assigned to the entity that has the smallest amount of volume. And once this has been completed, you all will likely be getting your results from PECOS. So that is the audit process where we send CMS a list of all the NPIs that plan to be participating within EQIP. Any care partners who don't pass the PECOS screening are not permitted to participate in PY5. And so the program integrity and law enforcement CMS vetting results typically are enforced around late 2025, and that impact is very small. It's very rare that anyone is running into any issues on that front. You can go to the next slide, Kim. And the third step that we're kind of going to be handling kind of in tandem with the duplicate NPIs will be succession entities. So one of the policies within EQIP is that any entity with greater than 60% of care partners that overlap with another entity from a previous performance year will essentially be considered a succession entity. And that's because essentially majority of the care partners from that parent entity are being moved over. So that is essentially making that entity a brand new entity. So you'll get a brand new entity ID number. And before this happens, all the entity POCs will be notified of the secession, and then within the portal, you'll be reflected with a brand new entity ID number. And then
So
the last
Crystal, we
step,
had a couple questions in
oh
the
yeah,
chat.
of
So
course.
Dr. Mitchell is asking, has Chris completed the duplicate review? In other words, can we expect more duplicate emails? I know that duplicate emails have been going out furiously
Yes.
this week. But maybe that's a very good question. I think a lot of people are
Yes.
curious about that.
Yes, yes, Dr. Mitchell. So the duplicate emails are completed. They were all completed on Wednesday, so you won't be receiving any more. I know there were a lot that were sent out, so apologies for that, but you don't have to worry about you don't have to worry about getting any more. So as long as you respond to the ones that you have, you should be good to go.
And then we
And
have another
then I think
question that I don't really understand. Is there a way to know the volume of the other entity?
we won't be sharing the information of which,
Yeah.
like the specific volumes of each entity. I'm assuming you're asking which entity has the amount of care partners that each one has. It's kind of just if you all don't respond by that specified date, our team will just delegate which entity that NPI will be routed to. We won't be able to let you know what the specific volume of each entity is.
But let me suggest this. In many cases, we all know who each other are, right? Maryland's a small state. If you're having difficulty, you can reach out to Crystal or Olivia or myself. We can create a discussion between the two entities so we can do what makes the most sense. So, and for example, last year, I think we had a discussion, MedChi and Hopkins had a discussion, and we made strategic decisions to put the care partners in the appropriate entity. Her question, I guess this is a further question, not strictly related to enrollment, but have we reopened discussion on resetting the baseline year for future EQIP performance years? That discussion with regards to the baseline, CMMI has not communicated with us about that again since last year. And with all the other things going on with regards to ahead in the negotiations, we have not heard anything yet. So I do not know whether or not or where that stands. They'll probably pick it up sometime after the first of the year. If you recall, what we ended up doing, because the emergency room doctors requested the change of a baseline this year, we changed the emergency rooms baseline as a pilot project to see what would happen. And that seemed to satisfy CMMI for the time being. So obviously the baseline year is not changing for 26. It's going to stay 2019. The baseline year for the emergency room docs did change, and that's where we are, and we have not heard anything else. But Katie, we'll definitely give updates in future meetings if anybody else asks that question. If anybody, when we know more and when we hear more from CMMI, but I do think that that's not going to happen until after they complete the negotiations and amend the ahead agreement.
Thank you.
Is that helpful? Anyway, all right, Crystal, sorry.
No, no worries. And so kind of the last step prior to any CPAs going out is just to make sure that all the entities are hitting that volume threshold requirement. And so the first aspect of that requirement is that 75% of the participating care partners that are within your EQIP entity must have at least one touch on any claim in the baseline year of 2019. And so this policy is just so that people who are within the program and in your entity are actually contributing to the work that we're doing within EQIP, and not kind of just sticking around for the possible incentive payment. And so if you do have a entity that consists of 10 or less care partners, then your threshold is only 50%, so it's a little bit of a difference. And any EQIP entities who do not reach this threshold, whether it be 75% or 50, you will receive an email from the EQIP team with a list of the care partners who do not touch a claim in 2019. And so from that list, the POC will be able to specify which care partners they would like to be removed in order to hit that threshold. And so in that email, we'll discuss you'll need to remove maybe 4 NPIs from this list to be able to meet either that 75 or 50% volume threshold requirement. And so if your entity is not contacted, then your threshold has been met. And this volume threshold requirement, emails, all of that is not going to go out until probably around sometime in October, early October, mid-October. So that's not something you have to worry about right now. But since we only have the subgroups bi-monthly, we just wanted to kind of give you all these details ahead of time. And so the next aspect of the volume threshold requirement is being able to, these actual episodes you'll be participating in. So it is required that for each single episode that you all are enrolling in, the EQIP entity must be attributed at least 11 or more clinical episodes in the baseline year of 2019. So for example, if you were enrolling in asthma and I can't think of another one. Let's say an emergency episode. You would need at least 11 episodes at the bare minimum to be able to participate in that asthma episode. The second part of that is that for all episodes that you will be enrolling in, you need to, in total, attribute at least 50 or more clinical episodes across every single episode that you're enrolling in. So if you were in asthma, EM, and let's say like low back pain, all three of those entities would have to at least add up to at least 50 or more clinical episodes for you to be able to participate in all three. Does that make sense? And if you have any questions, please feel free to come off mute or put it in the chat. I know sometimes that aspect can be a little tricky. Okay, awesome. We can go to the next slide if there are no questions here. And so the final part of the EQIP post-enrollment period will just be the care partner arrangement. So part of the program is that all care partners are required to sign a care partner arrangement. This contract essentially just stipulates that you'll be participating in the programs and the rules that you'll kind of have to adhere to while in the program. And so the care partner arrangements will be sent out to the individual care partners and the entity's administrative proxy via DocuSign at the end of October or the early part of November. And so this will be specifically for PY5. And the CRIS does have to confirm the payment remission addresses that were submitted during enrollment because this payment remission address will appear on your care partner arrangement as well. The contracts will be pre-filled and standardized across the state, so there won't be any changes that will be allowed. So just because of that, we do ask that if you are if you have submitted any care partners that perhaps do not have their updated email or updated complete information, we do ask that you go in there and make the appropriate edits that are necessary. Because these contracts will be coming via DocuSign, it is very, very important that the email is accurate. If it is inaccurate, that can obviously lead to the contract never being received by the specific care partner that has to sign it. And if you do have any questions or want to kind of learn how do I make the edits for these email addresses for my care partners, you can feel free to email us at equip@crisphealth.org. And so for the actual DocuSign email, it will come from the CRP entity, and the email address is right here in blue. It's equip@meritushealth.com, and you'll be able to see that in your inbox, and we'll kind of review in the next couple slides specifically what the care partners and admin proxies will see on their end when they receive the DocuSign link. And so please note that care partner arrangements are required to be signed and returned to participate in EQIP. If you do not sign it and we do not receive it, you will not be able to be participating in EQIP for that performance year. So it is really, really important that we get those CPAs in by their deadline so that you all can all participate in the program. And I see there's one question. What if an email address needs to be edited after CPAs are sent out? So in that situation, I believe, Kim, we would be able to send an updated one. We would just need to know as soon as possible. So if you do have an email address that maybe you notice is incorrect, just reach out to us as quickly as possible so that we can get the corrected DocuSign link out and that physician can be able to sign it. See another question. So the entities will not be responsible for sending out agreements and tracking whether or not they've been signed. Or will there be a way for an admin proxy to know when agreements have been signed so we can make sure they're all completed? Okay, great question. So on the actual email that will be sent out with the DocuSign link, the administrative proxies for the entity will be included on that email. So you will know when the link or the email has been sent out to that specific care partner. In terms of tracking whether or not they have been signed, we will be updating within the EAP portal once your CPA has been submitted, signed, and received. So you'll be able to go to EAP and you'll be able to click on that section I think I reviewed earlier that said Care Partner Dashboard. And in there will be a Care Partner Status Arrangement or Care Partner Arrangement Status. And in that section, you'll be able to see whether that the care partner has signed that agreement. And that way you'll be able to track who you need to maybe reach out to remind to send or to sign their CPA. So I hope that answered the question.
And I would just add to this. I know I'm looking at the list. We have a lot of administrative proxies on this call. We have a lot of people who are kind of responsible for entities. I really think it's important to have a plan. I know MedChi has over 1,000 care partners in the EQIP entities we administer. And I know we're working on a plan to figure out how to make sure the doctors know that they're going to need to do this because it is different from the prior years. So I would suggest if there's one takeaway from this meeting, maybe taking a step back and thinking about how you're going to make sure that everybody signs up so we don't lose practitioners from the entities because they didn't sign the DocuSign.
For
Agreed.
sure.
And
Thank
then the
you.
other thing, sorry,
Go ahead,
Crystal,
Jenny.
just the
No,
other
go
thing I
ahead.
wanted to point out is, you're not in this alone. Our team working with the CRP Emeritus, we're going to be tracking the care providers as well. So if it's not being signed and we know we need to reach out to you, we will be reaching out to you guys and letting you know, hey, these are the care partners from your entity that have not yet signed. What can we, can we get this taken care of? The last thing I want to make a note of is I know that there was a lot of questions regarding security with a lot of hospital systems and other places that have security in place for emails. So this is why we are providing you with the exact email address that'll be coming to you so you can work with your security teams for IT and stuff to ensure that these emails can come through. And then the next slide, you'll actually see what the subject line will say so you can maybe flag that as well. So it'll go through easily. Hopefully that answers all the questions.
Yeah, I see a couple more questions in the chat. One asked, how long will the window be open for signing? Can you share the due date for CPAs? So typically the window is open about November towards December. We don't have the official due date for the CPAs as of yet, but you will have substantial time. I want to say like about 6+ weeks to get those CPAs in. So it should be a significant amount of time. And if you do run into any issues, we're always open to meeting or kind of discussing if there needs to be any kinks that we can work out, at least to help make sure that everyone on your team can submit on time. Another question is DocuSign the only option? Can it be signed and scanned back to you? So the only option as of right now is DocuSign to my knowledge, but Kim, feel free to hop in here. Oh, happy that it's DocuSign here.
Yeah,
Yes.
so there's good and bad to both of it, right? And I do understand that some people are a little bit hesitant. Ultimately, we want as much as possible to be done through DocuSign. If we're finding that there are issues, maybe the DocuSign isn't coming through, something along those lines, we can work with entities to do a manual sign and send back in. The problem is, or rather the situation is that is going to be an absolute last resort. Okay.
Will it be sent to the CRISP email or the EQIP email address? So
no, DocuSign, I'm sorry, Crystal, DocuSign immediately goes right back to the CRP. So it'll go right back to Meritus. We will get copies of it. But it's all electronic. So you won't have to, once you sign it, it goes back to where it's supposed to go. Does that answer your question?
I think he was also asking like if it will be sent to the email that's registered with their CRISP account or with their EQIP account. For some people, it may differ. But post migration, since now the CRISP or the reports portal for EQIP lives within CRISP, your CRISP email and your EQIP email address should hopefully be the same. If you are noticing that perhaps your EQIP email address, the email that you submitted to participate in EQIP differs from your CRISP email, I would recommend that those emails are the same just for easeability purposes. And if you maybe are using your personal email address for EQIP, that's okay as well. You just have to make sure that they align both with your CRISP account and your EQIP login, if that makes sense. I hope that answered your question, Stuart. Okay, I think we can go to the next slide.
Okay.
Okay, perfect. So this is kind of what the contract will look like when it's received by your care partners. If you have a care partner enrolled, they'll receive this email, and from DocuSign, it'll be prompted by equip@meritushealth.com, and the subject will be complete with DocuSign within 48 hours, EQIP care partner arrangement agreement-HSCRC. And so if you want, you can, this slide deck will be going out after the meeting. However, if you want to just quickly take a picture or a screenshot of what this subject line will look like, that'll be useful to share with your care partners, so that they know what to expect, as well as with your security team to know that this will be coming from this specific email address with this specific subject line, just so that there won't be any flags or issues with viewing the email on the care partner side. Go to the next slide. And so once they click review the document, the care partners will receive the following pop-up message, and it kind of details the purpose of the care partner agreement as well as the steps to take if this DocuSign link were to expire. So as the initial email said, it is about a 48-hour window, and how we plan to set it up is just if that link were to expire, we'll probably send you a new email with a reminder that, 48 hours as the window for getting CPAs signed continues to go on. So there won't be an opportunity for, let's say, care partners to not be receiving these emails. If they perhaps missed the first one, they'll get the second one, and so on. And so if the link has expired and they see it, there is an option to send a new link. And so you'll just receive a new one, and your email will be able to kind of just link up with the information that was in the previous care partner arrangement email. And then once you've signed the forms, you'll receive a confirmation email. We do recommend that you just save that email for your documentation, just so you know, I've cleared that away. I've already submitted the CPAs, and you are good to go. I see 2 questions in the chat. Or one. For the care partners, will they receive an email to their CRISP account? So no, the care partner arrangements will not go to their CRISP account or like within the CRISP portal in any way. This will go to the email address that has been submitted specifically for the EQIP program. Most times they do overlap. However, I know for larger hospital systems, sometimes they have multiple email addresses. So it is definitely important to have those care partners at least share the email address that they should expect that care partner arrangement to be going to based on what email was submitted during enrollment. So it will be going to their specific email address that was submitted during the enrollment period. I hope that helps to clarify things. And so back to the CPAs, it will look like this screenshot below. The first page, I'm sure many of you who are returning have seen this exact page before. And you'll go ahead and you'll click that orange start in the left-hand corner, and it'll prompt you to start signing where you specifically need to sign as a care partner. We can go to the next slide. And so once the care partner clicks start, again, the DocuSign will guide the user through the document. On page 11 of the agreement, the care partner will be prompted to input their signature as well as the date that the document was signed. The EQIP entity name, the care partner name, and the MPI will all be auto-generated, so that information won't need to be inputted by the physician who is signing. We can go to the next slide. Awesome. There's one more question in the chat before I pass it back over to Kim for the EQIP Practice Transformation Grant. Thanks. Some of our partners signed up for CRISP on personal email accounts. Yeah, it's not an issue. As long as the email that is being used for EQIP is the same as the email that is being utilized for CRISP. It just helps for our system to recognize that this is the same person, essentially. So it's no problem if it's a personal email address. And I'll pass it over to Kim. Thank you.
Awesome. Thank you so much, Crystal. All right, so we're going to move on to an update on the EQIP Practice Transformation Grant. We had to pause the Practice Transformation Grant in program year 4 due to some policy and administrative shifts, but I am excited to share that we are bringing it back for PY5. Essentially, for all those who are new, this Practice Transformation Program is designed to support EQIP entities in making meaningful practice improvement that align with our care redesign and quality goals. So again, as I said, we had to pause this in PY4, but we are relaunching it for PY5. So let me walk you through the eligibility process, the application process, and then the timeline, and then I'll open it up for questions, okay? So we are, as I said, we're relaunching it right now. The eligibility for the Practice Transformation Grant is that you must be a participant for program year 5. only entities who are active in the performance year for program year 5 will be eligible. Programs year 1 through 4 entities, if an entity participated in program year 1, 2, or 3 and experienced at least 1 year of savings, meaning they did not generate savings, they are eligible. For program year 4 entities, they are included even though final reconciliation won't be available for program year 4 until June of 2026. So we won't yet know if they've achieved savings or not. So you are eligible. And then for brand new practices who joined for PY5, you are also eligible for the practice transformation grant. Again, this framework ensures that the practice transformation grant resources are targeted to practices that need the support and that can benefit the most from the practice transformation efforts. Okay. So the application process, I know last year a lot of you actually applied for the grant through the portal when you were doing the actual EQIP enrollment process. This year we are doing it through Microsoft Forms, and each entity will receive a direct link from our team via email, and you'll also find the link to it, the form here in the PowerPoint slides. The form itself is very straightforward. We'll ask you for your entity details, the name of your practice, any kind of doing business as name, if applicable, your address, primary contact, the primary contact of the person who will be the point of contact for any communication from both the EQIP team and your vendor regarding this practice transformation grant. We'll also kind of gather details like your specialty, any EQIP episodes that you might be participating in, your ownership type. Basically, are you an independent practice? Are you hospital affiliated, etc. And then finally, we'll ask you about your health IT setup, including which EHR that you're currently using. Are you fully connected to CRISP? Are you utilizing CRISP tools and resources, etc. The deadline for these applications will be October 6th. We will be sending out the emails to you all on the 22nd. So that's this coming Monday. It'll be sent out to you via email, the form. And if you can just reply by October 6th, then you will be in the pool of consideration for the actual practice transformation grant. After you submit your applications, the process moves through 3 kind of key stages. So first, we'll do an initial evaluation. We'll simply review all the applications to make sure the application is complete, that the entity meets the eligibility requirements, and then move forward from there. I just want you to note that, again, here's the link to the Microsoft form. You will get a copy of these slides and the recording after this webinar. It'll be sent to you, so you can utilize that, or you can also begin utilizing, it'll be sent to you via email and you can utilize that link. Either way, it makes no difference. The next step comes the practice assessment, which is a little bit more detailed. And this step helps us understand your workflows, your current capabilities, and the areas where you feel like you need additional support to make the most impact. And then we will do the vendor selection phase. So each entity will have an opportunity to choose from an approved vendor list. You will have information on the vendor's capabilities and qualities, and then you'll be able to select which vendor that you would like to work with. And then this ensures that you partner with the correct vendor that will be able to meet your practice's needs. I have a link here also. This link right here will take you to the practice transformation grant page, and it'll give you all the details of what the actual practice transformation grant is, what it will do. And again, if you have any other questions outside of what is available on the website, please feel free to email us at equip@crisphealth.org.
So Kim, first thing I want to say is I just want to thank Kim and Crystal and Krista, who's not on today from the HSCRC, because it's a lot of work to deal with all this, and no one really has seen all the work on the back end, and we've had multiple impediments for items totally out of everybody's control. But I also think it's helpful just to make sure everybody understands what that the grant that was given last year is going to move forward. We're going to reach out to those people and explain the details to it. So that's good news. So if you won the award in the prior year, that is still going to happen if you're interested in it, and we're going to follow up and get the details on that. That's
Okay.
separate from this. Correct,
So,
Kim?
no, we're actually doing a full new application process. And the reason that we're doing this is because a lot of the entities that applied last year have had they're now successor entities, and so they've had to change. So we need a full new revamp of the application process, just to ensure that we're not missing anybody.
Got you.
So if you did apply last year and your entity is the same, please reapply again. And again, we'll go through the same processes that we did, and we will then alert everyone who
So
actually
essentially,
received
though,
the grant.
but based on what Krista said, if you applied before and you got it and you're still interested, you're going to be okay.
For probably so, yes.
Yeah.
Yeah.
And I just, the other thing I wanted to let everybody know is that there is the HSCRC has to approve it, but we believe there will be savings in year 3. We've seen preliminary numbers, and there will be an additional allocation so we can take on new practices. So I think that's important to understand. And so that's the plan, at least as long as it gets approved by the commission. That's a little above our pay grade, but we believe that's the game plan. Is that fair enough to say with enough qualifiers, Kim?
I think so, yes.
Yeah, but that's what we're hoping to do. And I know that there will be discussion about that at the commission meeting on October 8th.
8th, right. Okay. So the time.
I'm sorry, there is a question in the chat real quick. It says, has this grant or similar been used in the past? If so, could you provide an example of how it worked or some transformation that was identified?
So no, the first time that this grant was ever available was for this, supposedly for program year 4, but as I stated, we had to put it on hold. So I can't give you any like examples of how it may have helped anyone, but I can tell you that we have vendors who are very fully qualified in being able to help you dig into your information, help you tweak your workflows, help you understand data that's coming through, and show you places where you can possibly make improvements. Again, the other side of this coin is there's no cost to you out of pocket if you are approved to be in the Practice Transformation Grant Program. So it's really not a major risk for you if you want to apply and you do get the actual grant. You can then select the vendor that you wish to work with, and that vendor can then help you sort of work through and tweak maybe some of your workflows, or maybe help you understand your data better and show you areas where maybe you need to make improvement.
But you have to select one of the vendors that was approved through the RFP process. So there were, I think, 4 vendors that were approved.
Correct. Mm-hmm.
There were 3 vendors that were approved globally and 1 that was approved for MedCai.
Right. Correct.
And I think we can also help answer any questions. If anybody has them, they can feel free to reach out, and we're happy to do that. And just I think the most important thing is if you think you might be interested, please get the application in, and please reach out through the EQIP inbox if you have questions about it.
Absolutely. Absolutely. We're always happy to answer your questions. Olivia, I think there was another question in there.
Yeah, so this is from Frank at Hopkins. He wants to summarize the ramifications for those care partners that also participated in MDPCP and received funding from that program, as well as those who previously reported to MIPS. So the funding for this transformation grant is coming from the shared savings of EQIP. The HSCRC in program year 2 allocated some of the savings the state realized from that year for 2 programs. One was a special primary care program, which actually did get implemented before the administrative changes that occurred sometime in early January of this year. But this, unfortunately, the grant program, because it was a little more complicated, got held up for that. And then there was another technical administrative issue with the entity that it administrates EQIP. So that money is not, it's really from the savings money. So there really should be no ramifications. There's no prohibition in participating in MDB, PCP, and EQIP. And if you're in EQIP, you're not reporting MIPS. You're not actually able to, because you're labeled as a QP, qualified person for as an advanced payment model. So I really don't think there are any ramifications for doing it. So
There are none. No,
Yeah.
there are no ramifications.
but essentially that really is the breakdown and where the money comes from. And we're happy to answer more questions, Frank. You can reach out to me or Kim or any one of us.
Yep, happy to answer them. Okay. Go ahead, Jean. Did you have something
No,
else you
I
wanted
was just going to say, I think one of the things is that this particularly can be a very valuable program for the smaller practitioners who maybe don't have the technology or care management resources. So anyway.
Absolutely. Okay. So the timeline, as I stated, the application period is September through October. So October 6th is the deadline. If you're at all interested, just apply, and then we'll reach out to you and, do our assessments moving forward from there. Then from October through November, this is when the assessments happen. And, we then let you know whether or not you actually received the grant. And then once you've been notified that you received the grant, then we start the vendor selection process, meaning that you get to basically understand all the vendors, all their offerings, and choose the one that you feel like would be the best match for you. Again, we'll have the grants selections announced in December, and then the kickoff meetings with the vendors will start in January. So you will start fresh for PY5, working with someone who can then help you work through all of your different workflows and start making suggestions to you on ways that you can make improvements so that you can create more shared savings.
So Kim, can I ask a question? Actually, if an entity was awarded the grant in the prior application and they went through the process, because a lot of the entities did meet with the 3
Yep.
or 4 vendors, and
Yep.
should they note that on the application that they would like to stay the same?
That
would
would
that
be
make
great.
your life easier? So
Yep, that would
it
be
was-
great.
It would just seem
Yep.
that if you could put if you went through the process, because I know, because Olivia and I and Kim, all 3 of us helped some of the entities meet with the different vendors, and I know some of the entities actually met with all 3 vendors or all 4 vendors in some cases. It would just make a lot of sense if you could note on your application and save us some time as far as processing them.
Yep, thank you for
Yeah.
bringing that up, Jean.
Yeah.
That's
we were so close. It was so frustrating to have
I
the
know.
other stuff get in the way of messing us up, but it's good we got it going again. And I also appreciate the fact the staff is trying to figure out how to get new people in. I think that's great, and I really appreciate, and I really appreciate the HSCRC helping us with that. So that's terrific.
Yep. So there'll be plenty of room on the form for you to, notate that information. You can say that, I applied for this for PY4. I was given the, the grant. I chose X vendor, and we'd like to stay with that. If that's what you want to do, perfect. If you want to take another look at all the different vendors and see the different options, then that's also, you can do that as well. And like Jean said, there's plenty of room on the form that you can note that in there. Okay. All right. So moving on. Next, we're going to move into quality measures. So during reviewing of program year 3 results, it was identified that the advanced care plan coding specifications were not necessarily fully aligned with HSCRC's intended approach. To ensure accuracy and fairness, the final program year 3 calculations have been updated in the portal to include both the 99 series codes, 99497 and 99498, and the CPT2 codes to ensure that all of eligible services have been properly captured in the reconciliation process. So for program year 3, because there was confusion, we went back and recalculated the quality measure for advanced care plan, and all of that has been noted in the portal. So all of that is updated and correct what's in the portal, and it includes all of the codes. Okay. So for program year 4, again, we're keeping the 99497 and 99498 plus the CPT2 codes 1123F and 1124F. And that will then satisfy the numerator requirements for the advanced care plan. So we're just talking about the advanced care plan right now. For program year 5, only claims that have the CPT2 codes 1123F and 1124F will count for the advanced care plan numerator. The policy and specification, the policy guide and the specification and methodology documentation both have been updated for program year 4 and for program year 5, and those documents are on our EQIP website. Okay, so for program year 4, just to be clear, the 99497 and 99498, along with the CPT2 codes, will be included and will satisfy the numerator requirements for the advanced care plan. However, for program year 5, the 99 codes, the 99497, 99498, they will not be included in the final reconciliation. Only the 1123F and 1124F will be and will count towards the advanced care plan numerator. Okay. All the other quality measures for the medication reconciliation and the BMI, they will follow the CMS specific defined guidelines with no exception. What's on those guidelines, that's how we're going to follow it. So here we have provided the actual quality measures for the advanced care plan. Here's the link, but again, remember, for program year 5 and forward, only the 1123 and 1124F codes are going to be counted. The rest of these will follow exactly what these guidelines specify. Okay. And again, if you have any questions, please reach out to us at the EQIP inbox, and we're happy to, walk through that with you if we need to. Okay. Moving on, we're going to move on to the data release schedule. So in here, again, for PY3, the data that is in the final reconciliation tab, that is final. It's in the portal. It is updated with all the correct information. That's where you stand right now for program year 3. For program year 4, episodes ending in March, episodes that have been completed through March are in the portal. Episodes that are completed through April will be coming in this month, towards the end at our second cycle release, which is on or about the 26th. And again, remember, these dates, like we're really dependent on these dates by the information that we get from CMS. So like I can give you an estimated date and time, but it's not necessarily going to be that exact date. It could be a little before, a little after. Okay. And then October we'll be getting May updates, and then November we'll getting June updates. Okay. We have some EQIP resources here. So basically, in a nutshell, we've provided, Crystal and Olivia have worked really, really hard at putting this EQIP curriculum together. We have the EQIP playbook right here for PY5, EQIP specifications and methodology for PY5, and the policy guide for PY5 is here. This information can also be found on our EQIP website. I would encourage anyone, especially anyone who is brand new to EQIP, to go through the EQIP curriculum. It is a very well laid out overview of EQIP itself, including short videos, slide decks, downloadable guides, etc. So I would encourage anyone who is new to EQIP to go to our website, or you can click these links in here and it'll take you through each of the guides. Our next subgroup will be November 21st. If you need access or you need to register for that, I think, Olivia, correct me if I'm wrong, once you register once, that's it. You've registered for the whole year. Is that correct?
Correct. If you registered for this meeting, the November subgroup should also be on your calendar.
Right. But if you have other people that you would like to have join the subgroup, we're always happy to have more people, because the more in the know, the better. You can reach out to EQIP, or you can reach out to Olivia, and we can shoot you that link so that they can register. We would prefer that you not share your personal registration, because it does come strict. The link is for you and you alone, so it'll show exactly who's joining us. So if other people are interested, have them reach out and we'll send them their own link. And that's it. Do we have any questions in the chat, or any questions that we didn't get to that maybe need to be answered? You're welcome to also come off mute if you have a question.
We must have been really clear today.
Yeah, that's wonderful. All right, well, if there's no more questions, and Jean, do you have anything else you want to update?
No, we'll send out the MHCC survey and the information on the advanced primary care with Dr. Jacobs to the group. Olivia will send that out later on this morning.
Perfect.
And that's it. Well, thank
All
you,
right.
everybody.
Have a great weekend, everyone.
Thank you.